All right, we're recording now. Hi everyone. Thanks for joining today's seminar series organized by the Empathic Computing Laboratory. I'm your host, Pi. And our guest speaker for today is Elizabeth Broadbent, who is currently a professor in health psychology in the Faculty of Medical and Health Sciences in the University of Auckland, which is the same as our lab actually. So her research interest is in combining health psychology and robotics to study healthcare robotics, which I think is quite a fascinating combination actually. So the title of her talk is Building Bonds with Robots and Digital Companions, which is about techniques that may build rapport as well as some barriers that needs to be overcome with robots and digital humans. The talk will be about an hour, and then later on we will have a brief Q&A sessions for about 30 minutes. For your information, this talk is recorded and will be uploaded in the future on our lab website, so stay tuned for that. So without further ado, over to you, Elizabeth.
Okay, thank you. I'll just say there's someone called Nicholas who's trying to get into the waiting room. I'm not sure if you can see that.
Yep, he's in. Yeah.
Excellent. Okay. I'm going to be talking about rapport with robots and digital humans today. And this is something that I've become interested in because I've noticed the types of relationships that people form with robots that we've been running in some of our studies. All right, let me just try something here. I can't control my slides here. I wonder why.
Maybe try disabling the share screen and enabling it back again, see what happens.
Okay. Have you stopped seeing it now?
Yeah, now it's stopped.
Okay, let me just, maybe I'll just do it like this and then, like without the thing showing. Might work better. Okay, I'll try it without playing it. I'll just click on the next slide. Okay, so I want to acknowledge that I work as part of the Centre for Automation Research and Engineering Sciences at the University of Auckland, where we have got a team that tests robots in particular in healthcare. And I've been working with Bruce McDonald and Ho Sugan and others, including nurses and doctors and engineers and computer scientists. And my expertise is particularly in the area of psychology. I also want to acknowledge that I do some consulting work with Soul Machines, who make digital humans in Auckland, and also have offices in the US and the UK. So today I'm going to talk a bit about why rapport is important with robots and agents, especially in healthcare, and then talk about how we might help to build rapport by using theory from doctor-patient communication applied to robotics. Then I'll talk about some experiments we've conducted in this area, as well as a systematic literature review that we did on which factors affect rapport with computer agents or digital humans. And then I'll just talk briefly about what the implications are and future research. So to begin with, it helps to define what rapport is. So this can be defined as a close and harmonious relationship in which the people involved understand each other's feelings or ideas and communicate well. So this can apply to robots and digital humans in terms of having cameras or sensors so that they can detect emotions and also their intentions through words and not only verbal communication, but also non-verbal communication. So why is it important to communicate well and understand each other's ideas and feelings in healthcare in particular? It's because in the medical context, you've got the patient there who's trying to communicate with the doctor what is wrong with them. So the doctor needs to understand the patient's symptoms and their ideas and perspectives. And then once they've heard what the patient has got to say, be able to summarize that and feed their understanding back to the patient to check whether the doctor understands correctly what the patient's complaints are. And then the doctor needs to be able to act on this in a therapeutic way by discussing what types of treatment might be available and then having a shared decision-making process. So these skills have been called physician empathy, and the ability to do these things well has been associated with higher satisfaction from the patient, as well as patients are more likely to follow the doctor's instructions. So in healthcare, because robots and digital humans are starting to be used in healthcare, I think these same skills are important for these technological agents. So for example, in this review of socially assistive robots for older people, there've been, in this review, there were 33 studies with 11 different robots. And the types of roles that the robots have been used for are affective therapy, which means helping people with their mood, so anxiety or depression, cognitive training, so games to improve memory, social facilitation, providing companionship, and also to help improve physiology, things like blood pressure, for example. And here are some of the different types of robots that were used in those studies, including sort of companion type robots, which are soft and fluffy, like Paro here, or a cat, or a teddy bear, as well as these more mechanical type robots that do more kind of reminding people to take their medication or educating them about what's wrong with them, as well as leading them through, for example, rehabilitation therapy after having a stroke or some kind of exercise therapy and doing tests. So those are the types of robots that are being used. Same with children as well. There's a lot of robots being used to help children in healthcare. This was a review we did last year, and we found there were 73 studies with 26 different kinds of robots. And most of these are actually quite small trials with the robots that are still being developed. So there's very few randomized controlled trials. But it's similar to with adults, the types of things that robots do are provide companionship and comfort, reducing anxiety and distress, for example, in children who have to have an injection, say for a flu vaccine or other kind of vaccine, distracting the child with a robot. Robots have also been used to express empathy and to be sort of like a buddy or a coach for children with diabetes. Robots have also been used in terms of telepresence. So this could be where the robot is placed in a classroom and then the child has got some kind of device through which they can control the robot and therefore attend school virtually. So you can see from these studies that robots are starting to be used in healthcare, and so it's important that we try and build them so that they do have this physician empathy or these good communication skills in order to build rapport. So this is a photograph from one of the studies that we conducted with Bruce McDonald and the robotics team at Selwyn Village. And this particular robot is a Korean robot called iRobi. And in this instance, it's got a blood pressure cuff attached to it, so it could take patients' blood pressure, and it could also provide entertainment. It could measure their oxygen levels in their blood. It had some information about what was happening in the village that day and some other things. And we tested this robot in a few different trials at Selwyn Village. And one of the things that we noticed was that the sort of the comments that people had at the end of the studies. So this robot was reminding people to take medication. And so people would say that they liked the time when their medication was due because they enjoyed talking to the robot. And same, the second one, they liked talking to him on the way past, rubbing his head, and the robot would spontaneously talk. And so they enjoyed the lights, the winking and the blinking. And when we took the robots away, people did miss them. So this robot didn't actually have any speech recognition. So there was very limited interaction. There was just touch screen buttons. And yet people still formed quite a good companionship with the robot that we found. It very interesting. And I've been interested in how to increase this companionship and what's responsible for it. We did another study. This was with patients with chronic obstructive pulmonary disease. And I'm just going to play a little bit of this video to show you the type of relationship that people form, if I can see how to fast forward it.
This project is funded by the HRC as part of...
I might leave that because I don't want to take up the time showing you the whole thing. But essentially, we had a randomized trial in which we had that robot iRoby in the homes of 30 people who had been discharged from Middlemore Hospital with COPD. And we compared it to a group who didn't have the robot. And what we were trying to do was to improve people's use of medication and the way that they did their rehabilitation exercises in order to prevent them turning up in hospital again. And we found that patients enjoyed interacting with the robots, again, even though they didn't have that many capabilities in terms of they didn't have any speech recognition. So some of the results were that the intervention group had higher adherence to their medication than the control group, and this was using these inhalers that had electronic recorders on them, so that every time they took a puff of their inhaler, it recorded it, so it wasn't self-report. And people reported, this was self-report, reported doing more exercises with those people who had the robot than the control group. And we also saw that those in the intervention group had fewer days in hospital than those in the control group in the subsequent 4 months. The robot was in people's houses for 4 months. Although this finding was not statistically significant, the previous ones were. And again, we found this companionship. So this person says they named their robot after their great-grandson because they missed the grandson. They named the robot Bob. He's like one of us. I'd pat it on the head and he would respond. I find myself having conversations with him. I had a 90-year-old friend come over to look at it and she loved it. She wanted one herself. And again, I will have no friend anymore. I liked having it in the house because it talked randomly and I would always touch it as I walked by. So touching it is because when you touched its head, it would say hello or would say random different things. So from these studies, I decided to study like how can we maximize this feeling of friendship and rapport? Because although some people said that, there were others who did not use the robot. They found it frustrating and annoying and basically gave the robot back. So I looked at some theory in terms of doctor-patient communication theory, and I adapted one of the models to turn it into robot-patient communication theory. So here is the model, and essentially you've got background variables. So the patient's age, gender, their culture, the education level, what kind of illness they've got, personality, experience, their needs and their cognitive abilities. And then here we've got the robot appearance. So what it looks like, what its voice is like, what gender it looks like or sounds like, its personality and adaptability. So these are kind of background variables. And then there are communication variables, which include affective and instrumental. So that means sort of like emotion focused and practical focused, verbal and non-verbal communication, relationship building tasks, the exchange of information, shared decision making. So it's not the doctor just saying this is what you should do. They should have a conversation with the patient about different options, and then a shared decision is made. It's important that information is kept confidential and that social rules for medical behaviour are followed. For example, you know, the patient gets changed behind a curtain and the doctor doesn't watch the patient get undressed. So the same rules should be applied for robots. And then these two boxes both influence patient outcomes. So how satisfied the patient is, how well they understand their illness and the treatment, how engaged they are, how well they follow self-management, and how well they adhere to treatment regimes, and it influences their health. So this model has kind of been shown to work in doctors, and I'm interested in seeing whether it works in robots and digital humans as well. So it is quite hard with doctors to actually manipulate these things independently. So what experiments typically do is they train doctors in communication skills in one group, and the other group don't get the communication training, and then they see which group does better. So essentially, doctors who are trained in these skills have better outcomes for their patients. So my hypothesis is that we can train or build robots and computer agents to do some of these tasks, and therefore we will get better outcomes. So some of these things are easy to change and some of them are quite hard to change. So things like changing appearance is quite easy. Things like verbal communication is reasonably easy, but something like shared decision making is actually pretty hard. And even sort of feeding back the doctor's understanding or the robot's understanding of the symptoms that the patient has, that's quite a challenging issue for a robot to do. But we have done some experiments in this area looking at some factors we can change, verbal and non-verbal communication behaviours, to see whether it affects user outcomes. So we've done 3 studies. One on whether the robot smiles or not and uses the participant's name. So that's a non-verbal and a verbal behaviour. Another experiment where we looked at forward lean, which indicates attention, self-disclosure, and voice pitch. And the third study where we looked at the use of humour. So this is the first one where we used smiling and use of first name by a healthcare receptionist robot. This is the robot. It's called Ever 4. It's a Korean robot where we just have the head, although there is a body that you can buy, but it's too expensive. So we've just got the head. So we looked at the effects of smiling and use of first name on user perceptions, attitudes, and behaviours. So this is the method. So we had 40 participants who were all healthy, and we used within subjects Wizard of Oz design, in that the robot was controlled by a human in this experiment. And so people took part in a scripted interaction with the robotic medical receptionist, which was repeated 4 times in a random order. In one condition, the robot was neutral, so it didn't smile and it didn't use the participant's name. In another condition, it smiled and it didn't use the participant's name. In the third condition, it used the participant's name and didn't smile. And in another condition, it smiled and used the participant's name. And our hypothesis would be that we would have best outcomes when the robot smiled and used the participant's name. So in the interaction, participants were told to imagine they were going to see their doctor for an appointment, and they had to, first of all, ask how long it was going to take for the appointment, and then afterwards they had to pay for it, they had to schedule another appointment, and they had to ask for a prescription. So the results of this study showed, we've got 4 bars here. The green bar is the friendliness score for those for the interaction where the robot smiled but didn't use the participant's name. The blue bars where the robot used the participant's name but didn't smile, and the yellow one is where it smiled and used the participant's name, and the grey one is when it didn't smile and it didn't use the participant's first name. So basically, it showed that in both the smiling conditions, the robot was rated more friendly than in the non-smiling conditions, whereas using the participant's name didn't seem to have any effect on ratings of the robot's friendliness. Similarly, we saw that in the conditions where the robot smiled, the robot was rated as having higher agency, so that is the ability to think and communicate and do things. And it was also rated higher in the ability to experience things. So this is experiencing emotion or experiencing hunger and pain and things like that. So again, the use of the participant's name had no effect, but smiling had a significant effect. Similarly, we found that smiling resulted in better attitudes towards the robot and more human-like perceptions of the robot. Use of the participant's name had no effects. Personality, when the robot smiled, the robot was rated as more generous, happy, good-natured, warm, sociable, and humane. And when the robot, in the conditions where the robot smiled, the user was also more likely to smile. So essentially what this study is showing is that smiling had a beneficial effect, whereas the use of the participant's name had little effect. There was one finding with the use of name. So use of the participant's name was associated with perceiving the robot as more humane, but that was the only difference we found. And in general, the majority of people thought Eve would be a good addition to a doctor's clinic, but they thought she couldn't handle complex tasks, which is fair enough. In the second study, we looked at the effect of robot attentional behaviours on user perceptions. And in this one, we were in particular looking at attention, because it's important to be able to attract people's attention, maintain people's attention, and to also to show attention during communication. So the behaviours we looked at were self-disclosure. So self-disclosure, that is when you disclose something personal about yourself. It has been shown to increase eye gaze, smiling, perceived friendliness, and rapport. between humans, and it's been shown to be central to developing social closeness in human relationships. In terms of robotic studies, self-disclosure has been shown to reduce anxiety and increase likability of robots, but nothing's been looked at in a healthcare situation. We also looked at voice pitch, because the pitch of your voice is very important in attracting attention and keeping attention, and it also can convey emotion. And in previous robotics research, higher robot pitch was related to increased robot likability and more enjoyable interactions, but nothing's been looked at in healthcare robots, and also forward lean. So one of the ways that we show that we are paying attention to someone is that, and that we're engaged, is that we lean forward towards them. And so it's been associated with positive perceptions of physician empathy in patient-physician interactions, but no research has looked at how a robot leaning forward might affect people's perceptions of it in healthcare. So we were aiming to see whether these three behaviours, self-disclosure, forward lean, and voice pitch, would increase attentional behaviours and perceptions of robot empathy. And in this study, we used a different robot. We used Now robot, and we had 181 participants. And in this one, we randomized them to different groups. So we had a similar script. It was slightly different. People had to pick up a prescription, make a doctor's appointment, they had to wait for the doctor, and then they had to ask for the bathroom, instructions for the bathroom. And the 4 conditions were, people were randomized to one of these conditions. Either the robot had 2 additional statements where it self-disclosed a little bit about itself, and they were, I'm a little nervous about this task, and I forget things too sometimes. Or they were randomized to a voice pitch condition where the robot varied its voice pitch when it said certain statements. In the third group, the robot leant forward when it was speaking and upright otherwise. And in the neutral condition, it didn't lean forward, it didn't use self-disclosure, and it kept its voice at a constant pitch. And so we showed that when the robot, for people who were in the forward lean condition, the robot was rated as more stimulating, more interesting. People spent more time looking at the robot, and more participants kind of mirrored that behavior in terms of leaning towards the robot as well. So that's this image down the bottom here. That's the Now robot leaning forward compared to being upright. So we think that these behaviors of increased eye gaze and increased leaning might indicate increased participant engagement and a form of mirroring. In the self-disclosure condition, where the robot said these 2 statements, again, participants rated the robot more stimulating and interesting compared to the neutral condition, and they spent more time looking at the robot compared to the neutral condition, and more participants laughed during the interaction compared to the other conditions. And that's probably because they found these statements to be funny, because robots don't normally kind of say that they're nervous or that they forget things. And we found no significant effects of voice pitch. So varying the voice pitch had no effect on any of the outcomes. The other study that we conducted was looking at the use of humour by a healthcare robot. And this paper is in press, it should come out soon. And this was, again, we went back to the Eva robot, the Korean kind of human-like head robot. And in their last experiment with the Now robot and in this experiment with Eva, that was when the voice recognition technology had got better. And so we were using kind of chatbot technology in order to have the robot operate autonomously without the Wizard of Oz design. So in this experiment, we had a flu vaccination scenario in which people came in and asked for more information about a flu vaccination. And so we randomized people to two different conditions. One condition was where the robot was neutral, and the other one was where we added a few humorous statements. So this, the overall interaction was longer than this. This is just a part of the conversation. And the bolded bits are, bolded italic bits are the humorous statements. So for example, it said, one of the humorous statements was, I caught a computer virus last year and it was terrible. That will teach me to use a strange computer's flash drive. Ha ha. So they're not terribly funny, but people did laugh at them. And one of the reasons we looked at humor is because in patient-doctor communication, actually in over 50% of GP consultations, humor is used. So it might not seem appropriate, but actually it's quite commonly used and has been shown to relax people and make the whole situation, I guess, makes the people have said that the doctor appears more relatable when they use humor. So we thought perhaps the same thing might happen with robots. In terms of our outcomes, we used the Godspeed questionnaire, which measures the robot's likability, intelligence, safety. It's not anomaly, it must be animacy, and anthropomorphism. We also looked at robot empathy using a couple of questionnaires, and the robot's personality using the ASH personality checklist. And we also observed whether participants laughed or not. We used a mixed ANOVA between conditions and over time. And these showed that the people in the humorous robot condition saw the robot as more likable, more safe, more animated, and they perceived it as more empathetic and that it had a more sociable personality. So humour seemed to have quite strong effects, and users were more significantly more likely to laugh in the humour condition as well. So the results of those three studies support the theory that we put forward, that the same types of behaviours that doctors display with patients of verbal and non-verbal communication skills also help to improve rapport with robots. So some of the limitations of these studies is that they were conducted in a laboratory, not in a real doctor's clinic, and that's for reasons that, you know, the technology is not yet robust enough to use it in a doctor's clinic. So it's more kind of like a proof of concept. So if we turn now to digital humans and computer agents rather than just robots in healthcare, there is starting to computer agents are starting to be used in healthcare, and an example is in virtual palliative care. This is an agent that was used in a feasibility study with 55 patients at Northeastern University and Boston Medical Center. And it really, as you can see, it's not a very high-tech kind of computer agent. It's just like a cartoon figure, and it didn't even talk to you. So it's not like the advanced ones we have today. And, you know, you just clicked on things on the screen. But nevertheless, patients were very happy to talk to the computer about palliative care because doctors don't often talk about this with patients, or they don't have enough time. So it's some of this is, so palliative care is around when people are dying, and also so it's when treatment's not going to actually cure the problem, but it's more kind of looking after people in the end of life stage. So looking at people's preferences for end of life. So people found this quite useful, and now it's a full randomized controlled trial. There are other agents that are being used in healthcare as well. This is some Sensei, and this is particularly being used with the military in the US. So people who come back from service and they've got symptoms of post-traumatic stress. So I'm not sure if this will work, but it's worth watching maybe in your own time. But what this does is it's got a camera on the screen that monitors the user's facial expressions, and it monitors what people are saying, and it responds empathetically to these signals. So we know that trying to detect people's emotions from facial expressions is not easy, and it doesn't relate one-to-one. So when we smile, for example, smiles can indicate kind of submissive behavior, that people are saying, okay, I'm friendly, I'm not going to hurt you. And they can also indicate sort of anxiety, so a nervous smile, as well as indicating happiness. So there's many different reasons for people to smile. So detecting emotions through facial expression doesn't have a one-to-one correspondence. Nevertheless, digital humans and computer agent software do try to do this. And this is an example of one that's being used. So this has been developed by Skip Rizzo and others. So here is a study that's used a virtual human interviewer, and this was where people were told by randomly assigned that either the virtual human interviewer was teleoperated by a real human, like a puppet, or it was fully automated. And one of the things that we seem to be finding in this area is that people open up more when they think that the agent is fully automated. So they are they have lower fear of self-disclosure to the computer than when they think there's a real human operating it. Also, they show fewer impression management behaviors when they think the agent is fully computer operated rather than operated by a human. So several studies have shown this, and it seems to be because people think that humans judge them. So if you are disclosing something about yourself, then you're afraid either that the human is going to judge you or that they are going to punish you in some way, particularly in the military, where, if you report that you've got post-traumatic stress, maybe that's going to influence your career or where they send you next on assignment, or they might take you off your assignment. So it seems like the military is quite a good use case for this. Another use case for virtual humans are to use virtual patients. So to train clinicians how to talk to patients. So essentially training clinicians in verbal and non-verbal communication strategies to increase rapport. So it's quite interesting. This is kind of like turning it on its head so that you can get medical students practicing talking to patients who are virtual. And then because you can record those those interactions and you can analyze different behaviors, then the results can be used to give feedback to the trainees on how well they were doing. So I've got a PhD student who's working in the area of digital humans for people to help lower their stress levels, and also another study to help with loneliness. So we were interested, she did a review, this is Kate Lovey's, on the effect of design features on the relationship quality with embodied conversational agents. So she screened the literature and essentially found 43 studies that were included due to the eligibility criteria. And the types of digital humans or computer agents that were included here are a few examples. The first examples are of rapport agents from USC, and this one down here, Laura, is from a FitTrack exercise advisor from MIT, and this last one is from Western Sydney University. So they range in how detailed they are and how human-like they are, so how lifelike they are, really. And what we found was that in terms of the number of studies, there were quite a few studies that looked at computer agents for companionship and healthcare, as well as commercial settings, educational settings. There were also some that looked at the effects of design features on computer agents in gaming, museum guides, and when no context is given. And in terms of the different design features that have been studied, most have looked at behavior, some have looked at language, others at emotion, embodiment versus just a voice, looking at appearance, what type of environment people or the digital human is in, personality, and a combination of these factors. So when we did this review, essentially it's quite a long review, but this is condensing the results right down. We can see that the design features that improved relationships or social perceptions and behaviors towards these embodied conversational agents included having a virtual body. So when the agent is drawn with a body compared to just having text, that improved the relationships. When the agent had a more human-like voice, that was better than when it had a more robotic voice or when there was only text on the screen. When the conversational agent used some small talk or self-disclosure or humor, this improved the relationships as well. When the agent used some relationship building behavior, including affiliative eye gaze, so that means actually looking at the person rather than looking away, and using cooperation behaviors, that improved relationships. When the agent included emotions in their voice and in their face, compared to no emotions, that was also shown to be positive. And finally, when people used a combination of relational language and behavior, this also improved relationships. So then we expanded the model that we built on robot-patient communication, and we kind of extended it to more context, and not just healthcare, but also with computer agents, not just robots. So we changed it a little bit to have a user factors box, an agent factors box, and a context box. So the context includes kind of like the social environment. So which other people are around, which environment is it being used in terms of, is it a commercial environment or healthcare, or is it something else like education? We've got the same sort of similar user factors as we had before, but we've included emotion as well. In terms of agent features, these are similar to what we had for robots, but now we've included personality as well and cooperative behavior based on the review. And these are the results. So these three types of factors can, in combination or by themselves, affect these kinds of outcomes. So relationship quality, perceptions of the agent, their behavior, their enjoyment, their rated quality of the interaction, their knowledge, satisfaction, etc. These ones with question marks beside them mean that we haven't tested that yet. So it'd be interesting, and something for future research to do, is test how these factors affect self-management, compliance, and health status in people who have got, say, chronic illness or some kind of healthcare condition. And it'd be also interesting to see in another context, so kind of in an educational context, how do these factors affect learning outcomes, and how do they affect purchase outcomes, so whether people actually buy a product online or not, based on the agent features. So in conclusion, these studies and the review have shown that we can increase rapport with robots by using both verbal and non-verbal physician communication skills behaviors, including smiling, having the robot leaning forward, self-disclosing some information about themselves, and using humor. And that those results support the model of robot-patient communication. And our literature on embodied conversational agents and rapport suggests that the words that we use, how much emotion we express, types of relationship building behaviors, and physical characteristics of agents can affect the rapport that people develop with them. And so we can use all of these results to try to improve rapport with robots and with embodied conversational agents. But there hasn't been a lot on health outcomes. So we need to see whether changing these aspects actually does affect, say, whether people decide to take their medication or not, and whether it affects their satisfaction in a real healthcare context. And the other thing that we found that isn't really reflected in the model so much is that errors in the software can have a big negative impact. So we need to make sure that we reduce those as well. And finally, I just want to let you know about a study that we are currently recruiting for. This is my PhD student, Kate Lovies. So she and people at Soul Machines have been developing a digital companion for to try and reduce loneliness during COVID-19. And we're interested in getting any participants who are older or who've got a chronic illness to study whether interacting with a digital human can help reduce their loneliness. So if you know anybody who might be suitable for the study, then you can email me and let me know, or else this study is advertised on the Faculty of Medical and Health Sciences webpage. And I will stop there.
Great. Thank you very much, Elizabeth, for your wonderful presentation. Which I think is actually quite useful for a lot of students here because we have a lot of them working on empathy research as well as emotion recognition. So I imagine there should be a lot of interesting questions. So we're now open to questions, and if you have one, just please raise your hand, and then I'll just unmute you. Otherwise, you could type it down in the group chat, and I'll just read out your questions. So, would anybody like to start? Well, I suppose I'll start with the question first. So I really like that a lot of this research is looking into some of the important consideration and parameters for designing a robot interaction for medical use cases. I'm just wondering, since I think our research here doesn't really deal with medical, but we do deal a lot with digital humans and robots. How many of these features do you think translate into regular home assistant robots as well? So for example, let's say, to replace Google Home and Amazon Alexa, these that we have at home, do these features also translate to these robots? I think what I'm trying to say is that I'm sure you've heard of Jibo. So Jibo is that home assistant robot, which it didn't do well because it didn't perform as well as Google Home, didn't it? But it was still well received, and regardless of its motions and everything, which I think is much better than Google Home. Actually, maybe I'll just share the link on the chat for Jibo. So I'm just wondering if some of the results that you found also apply to the home assistants robots.
Yeah, I think they do. I think the human-like voice is quite important. We have done some earlier studies with comparing a robot a robot with a New Zealand accent compared to an American accent and a British accent, and they like people in New Zealand preferred the one with a New Zealand accent. So I think the voice is very important, and it can affect people's perceptions of the whatever kind of technology it is. It's important. And with things like Alexa or Siri, they are a bit different because typically they don't actually have a physical embodiment apart from being like a smart speaker. So I think it would be so interesting to dress up a smart speaker, somehow put Alexa into a body and see how that affected people's perceptions of it.
Yeah, I think your mention about accents is actually quite interesting because we also did a recent work. Some of the participants in this talk as well have worked together on a work on understanding the voice for this digital assistants, and we did get a lot of feedback regarding the accent being one of the key features actually. And as you say, there's a lot of local people who prefer like a Kiwi accent or New Zealand accent as opposed to maybe like an American accent. So yeah.
Yeah, the American accent was the least preferred. Like British was better than American in our study.
Right. Is there any other questions from anyone else? So there's a question here from Alison. She asks, did the research indicate any participants' preference over female voice or robots or over male voice or robots? So regarding gender, basically, is there any significance between them, and is there a reason why?
Yeah, we haven't looked at that specifically, so we haven't had sort of a neutral looking robot and put a male voice on it or a female voice on it. We have asked participants in a study, it was just asking about what people wanted in a robot. We asked them whether they wanted the robot to be male or female, and more people said they wanted it to be female. And I think that it might be because of the healthcare role, and people were thinking that a lot of nurses are female. So it might be sort of like a stereotype. But yeah, I've certainly seen discussion documents about the fact that a lot of digital humans are female, and what the reasons are for this and what the consequences are. yeah, I think it's definitely an interesting thing to look at.
I hope that answers your question, Alison. Is there anybody else? Yeah, great.
Can I ask a question, Pi?
Yeah, sure. Lay it out.
Yeah. I have to wait somebody?
No, it's good. You can ask, Ishan.
Oh, okay. Hi, Elizabeth. This is so interesting. Looking at especially the soul here, the soul machine. I'm just wondering. I think I joined the experiment a couple months ago. But I'm just wondering, have you tried to measure to what extent the synchronizations, like kind of the attachments that has been built between a participants and your your robot, quote unquote, like for example maybe through the brain synchronizations or like hyperscanning that we did in the lab, or maybe through other measurements, maybe heart rate synchronizations. I'm just wondering because this is so interesting.
No, we haven't done that. We have looked at physiological measures in terms of heart rate, galvanic skin response, but we haven't looked at any kind of brain synchronization things. So yeah, that's an interesting area.
Okay, yeah. Thank you.
Great. Let's keep the questions going. Anybody else?
I have a question.
Yes, Samantha.
Thank you so much for the talk, Elizabeth. I wanted to ask a bit more about what are your plans, or sort of what's the future work for yourself, bring all these ideas forward.
At the moment, we're trying to translate some of the therapy that humans deliver in terms of stress management programs. So I'm collaborating with someone who has developed a stress management program for women with breast cancer. And this therapy is typically delivered in a group format where there's a therapist and a group of women with breast cancer, and they meet for 10 weeks and they discuss strategies to reduce stress, and they practice deep breathing exercises and mindfulness exercises and meditation exercises and things like that. And one of the things that I guess we would like to improve about this therapy is that currently only a limited number of people can get access to it. So we want to increase the accessibility of this kind of therapy, and we're wondering whether a digital human can deliver it. So we have developed one session with it, and the goal is to test this one session to see how acceptable it is, see whether it helps reduce people's stress. And then once we've got the results of that, then try to obtain funding to develop all 10 sessions. And then we can test it with women with breast cancer and see if it helps to reduce their stress. So that's one of the things that we're working on at the moment. And yeah, another thing I'm interested in is loneliness, as you can see in this slide, in that loneliness can also have a big impact on people's health in terms of your immune system doesn't function as well if you're not getting as much social support as you would like. And this can have effects particularly on cardiovascular disease. So because of some of that, I guess, companionship stuff we've seen in terms of people enjoying having the robot in the house, particularly people, and other studies have shown that people who are lonely tend to ascribe more mind to robots, so that I think the robots have got greater abilities than people who are less lonely do. So I am interested in more of this companionship side as well, which I think is a little bit different to the physician communication behaviors. I think it's less about I guess, I mean, it still involves rapport, but it's more of like a friendship rather than a medical kind of relationship. So I'm interested in doing more research in that area, in terms of what are the factors that can improve kind of like, yeah, companionship.
Thank you.
Is there any more questions?
I have a really quick question
Yeah.
towards the companionship as well as personal privacy, because I remember Liz mentioned very early on that people who are unlikely to chat with a real human about their privacy, especially in the military base. So I was just wondering, in terms of designing or making the robot, is there any research results indicating that the more human-like the robot is, the more people are willing to, talk about their, private stuff, or if the robot is more designed like an actual robot or a dog-like, or like, just a more fluffy, cute-looking thing that people are more likely to empathize with and then talk more about the real, like, feelings about their life and stuff like that. I'm just a little curious about that. Thank you.
Yeah, I guess what some research has shown is that the way the robot looks should match its task, so that there was some research early on with a very fluffy type robot that was designed to be like remind people to take their medication and also to perform eye tests on people, and that wasn't very successful because people expect a more serious looking robot to do serious medical tasks, and for a fluffy robot to be more like have the same capabilities of as a dog or a cat or a sort of animal. So I think the way the robot looks influences people's perceptions about its capabilities. So you need to design it to match the capabilities you want people to think that it's got. In terms of companionship, I think probably, one of the most successful robots has been Paro, which is the fluffy seal robot. And I think it's because it kind of reminds people of their cat or their dog. And so they like to cuddle it. And so therefore it really helps with companionship. But I have been interested in the more, I guess, plastic, non-fluffy robots and the way that people also form relationships with them, even though they don't cuddle them, but they do pat them on the head when they actually talk to them. So I guess I do think that some of these appearance characteristics and fluffiness does affect, like, increase companionship. But there are things that we can do to increase companionship with non-fluffy robots as well.
Thank you.
Just to add to that, so regarding the non-human robots, so I understand that it could influence the perception of patients because maybe they won't take it seriously. But do you think it would be more effective effective for child patients, maybe?
For children, yeah. I mean, children are a little bit different because children, have got quite active imaginations, and, they talk to their teddy bears and all that, and they have dolls and all that kind of thing. So yeah, I do think it's a little bit different with children. And children are much less scared than older adults are with robots. Often older adults think they might break the robot, or they're not quite sure how to use it, whereas children are all hands-on and they just push all the buttons and they don't really care what happens. So it's quite a different type of interaction that you're designing with children. I do have a student who's trying to come out here from Spain to do her PhD on robots for children in hospital, but because of COVID, she hasn't been able to get here. But hopefully she can get here soon.
Yeah. Okay. Maybe one more question. I have one more.
Can I ask a question?
Yes, sure.
Yeah.
Go ahead.
Yeah. Great talk, Elizabeth. So, my question is about like the emotional induced emotional experiences in the participants. So, like, did you find anything interesting about them who were interacting with, let's say, soul machine or like a virtual avatar, and in a different emotional setting? So, for example, like when the machine is responding in a happy or angry emotional responses. So, did you find anything interesting in the participants, whether they could empathize with the robot, or like how was their emotional response?
Yeah, I guess we try to avoid having the robot or the computer agent being angry or having negative emotions, because previous research has shown that people respond better to robots who are sort of got positive emotions. We did do one study early on with robots where we had a very, very frustrating robot versus a more obedient robot, and looked at the types of emotions that that induced in people. And it was quite interesting because people tended to blame themselves when the robot wasn't performing properly, even though we had actually programmed it to be very frustrating. But yeah, I mean, people did have more negative emotions towards the frustrating robot, for sure. Yes.
Yeah. Okay. Yeah, and another follow-up question. I mean, not follow, but yeah, different question. But like, have you tried these therapeutic agents in a focus group scenario? So, like, basically, multiple people in a social interaction, and yeah, when they are talking to them, how do they respond?
At this, I guess we have had some robots in retirement villages where there have been multiple people present. So, for example, we've had robots in the lobby and reception area, and sometimes, you know, there are more than one person in people's houses. So, generally, the robots, we have programmed them to have face recognition so that they recognize the user and can respond more personally to that user by saying something like, you know, I think I'm interacting with John, is that correct? You know, based on facial recognition technology. And when another thing is that when people are interacting with groups with the robot, they tend to also talk to each other about the robot. So it's kind of like a conversation that you might have about a dog or something, where you say, oh, isn't he cute? Or you know, they'll say, oh, I think the dog wants something to eat, or something like that. So they'll talk about the robot in that way. So the robot does tend to facilitate conversations between people, but we haven't really been able to have a conversation where the robot will talk to one person and then they'll talk to the other person. We haven't got that far.
I find it interesting, like how would be the trust factor. So I remember you mentioned that like people preferred the agent to be like fully automated agent, so that they can be more sort of like they have confidence and trust on that agent rather than like in the Wizard of Oz. So I just feel that what could be the thing in a focus group scenario?
Yeah, I'm not sure that a
Especially about sharing
robot
the personal
could
information.
cope with I don't think a robot could cope with a focus group scenario. It's just, I mean, it could ask the questions, but it couldn't really understand everybody's responses. And obviously you'd have the other humans around as well. So I think people would still be quite self-conscious about what they were saying.
Yeah, thank you very much, Elizabeth.
Great. I think I have one last question, and then we'll probably call it a day. So I was looking at the Korean robot head that you were showing. It looks really interesting. I was just wondering if you got any feedback regarding the uncanny valley effect from that robot.
We didn't get a lot actually. We kind of expected that people would find it uncanny, especially since it's just a head without a body. But we put like a scarf around its neck so that you couldn't see all the like
Mechanical parts.
the metal, yeah, the mechanical parts. And I guess people didn't find it as uncanny as we thought they would.
Interesting.
Yeah.
All right, so I think if there are no more questions, that should be the end of our seminar for today. So thank you again to Elizabeth for sharing her research, as well as everyone here joining this talk. And I hope to see you guys in the next seminar, which should be 2 weeks from now. And I'll share more information about that later. So thank you, everyone.
Okay.
And
Thank
I'll
you for
now.
inviting me.
Thank you.
Thank you. Yeah,
Thank you.
I'll end the recording right now.